Good evening and welcome to the program Easy Access to Healthcare for All. This program details events and activities in and around the National Health Insurance Authority, NHIA, and indeed the health insurance ecosystem. In this episode, we will bring you an interview with Professor Mohammed Nasir Sambo, Director General, National Health Insurance Authority, where he shares some important details as it concerns the implementation of the new NHIA Act and how it will improve service delivery in Nigeria. Join me after the break for the full package. My name is Aisha Muhammad Ahmed, your regular anchor. See you after the break.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
We begin with a highlight of events around the NHIA. In the news, Edo State Health Insurance Commission celebrates Universal Health Coverage Day.
The Lagos State Health Management Agency has unveiled a new plan under the mandatory Lagos Health Scheme, tagged Ilera Eco Diaspora Health Plan. The move is geared towards increasing access to qualitative and efficient health service delivery, as well as further pushing the drive towards attaining of universal health coverage in Lagos State. Speaking at the launch, Professor Aikin Abayomi, Lagos State Commissioner of Health, said the plan provides an opportunity for Nigerians living abroad who desire to provide and sponsor health insurance coverage for their loved ones resident in Lagos State. He added that the launch of the product is a milestone achievement for them, noting that the new plan marks an era of globalization in the operation of the health insurance ecosystem. Also speaking at the event, Dr. Emmanuel Zamba, General Manager, Lagos State Health Management Agency, explained that the new plan will guarantee affordable and quality health care service through third-party financing and management system that enables pooling of funds and medical expertise. In its commitment to sustain the awareness of the need for all residents of the state to receive health coverage while getting the full grasp of the benefits of the Edo State Health Insurance Scheme, EDOHIS, the Edo Health Insurance Commission, EDHIC, organized a road show, mega market, to commemorate Universal Health Coverage Day. The theme for the year is tagged, "Let's build the world we want, a healthy future for all." Addressing journalists at the event, Dr. Roch Amego, Director General, Edo State Health Insurance Commission, said that the event was a medium to sensitize Edo people on the role of EDOHIS in the attainment of Goal 3 of the Sustainable Development Goals, which is to ensure healthy lives and promote well-being for all at all ages. He then spoke on how Edo residents can avail themselves the opportunity to get health coverage. Also present at the event were the representatives from Edo State Office of the National Health Insurance Authority, Mr. Ehanire, who described the event as a beautiful initiative that will give people the opportunity to know their health status. Delivering the sensitization talk, Mr. Efosa Oyegun, Director, Business Development of the Edo Health Insurance Scheme, enlightened the traders on the several packages as well as the benefits of the scheme.
The program is Easy Access to Healthcare for All, a program that brings you highlights of news and happenings around the National Health Insurance Authority. The mission of the NHIA is to mobilize and pool financial resources for strategic purchasing of affordable and quality health care for all Nigerians. Attaining its objective of universal health coverage has been boosted by the transition of the NHIS from a scheme to an authority by the NHIA Act. In our next segment, we bring you highlights from an interview with the Director General of the authority as he explains how the NHIA functions and its plans towards implementation of the Act. Do stay tuned.
The NHIA is one of the parastatals of the Federal Ministry of Health, which is saddled with giving easy and quality healthcare to Nigerians, irrespective of their socioeconomic status. This care can be curative, preventive, as well as rehabilitative. It strives on pooling of funds and cross-subsidization that enables the authority meet its mandate.
Probably
Professor Mohammed Sambo throws more light on how the NHIA achieves its mandate.
So if you pool that resources and you are pooling that risks together, so anybody who is sick, and it's likely that the poor people will have more frequency, high frequency of or chances of seeking for care. So you now take the money and pay for them. So they have contributed less, but they are benefiting the more from the social health insurance. So that is where the cross-subsidization is coming. And when we say risk pooling, you look at the community, you find out what is the prevailing healthcare problems, what are the prevailing healthcare problems in the community. Maybe malaria, upper respiratory tract infection. So if you look at the pattern, the epidemiology, the pattern of the distribution of the disease in the community, you will realize that there is a time when upper respiratory tract infection will be more prevalent, and when you have upper respiratory tract infection, some people will have it today, and some people might not have it today. So those who have upper respiratory tract infection will benefit from the services. At the same time, while these people are having the upper respiratory tract infection, you might have a woman that is coming in labor. She wants to deliver, and you now take the money and deliver her baby, whether it is through normal delivery or through cesarean section, as the case may be. So you continue to do this kind of permutation and combination with the resources, so that in the long run, anybody that is sick will have opportunity to benefit from the pool of the resources. This is the appealing feature of the health insurance. So you can be protected once you are in the health insurance. You are guaranteed that with just identity card, a means of identification, you can go to the healthcare facility of your choice and seek for services, whether or not you have resources at the point of the service delivery. Then you get the services.
In May 2022, the President signed the NHIA Act into law. This move has also strengthened the operations of the NHIA, as the new NHIA Act is seen as a game changer that will help the authority fulfill its mandate. Professor Sambo explains further its highlights and why the old law was repealed.
One, the law was not made mandatory. So if you like, you join. If you don't like, you go. And if you look at the hallmark of the social health insurance is you want to do cross-subsidization to take care of the poor. Because the rich, they have money. Anytime they are looking for services, they can go for it. So the ultimate beneficiaries of the health insurance are the poor. When you do apply the concept of cross-subsidization. So that law, that NHIS law, did not make health insurance mandatory. That's why, despite so many years of implementation of health insurance, the level of penetration is still very low.
Professor Sambo also speaks more on some provisions of the new law.
Number two, if you are talking about attainment of universal health coverage, there are some people in the population that cannot be able to, that are grappling with 3 square meals, and you now ask them to put their money in advance for healthcare services. They will never do it. In fact, they don't even have the money to do it. So these are the vulnerable, these are the poor, these are the downtrodden. So any law that has not provided an opportunity for how to mobilize the resources for that poor, so that they can also join the health insurance. You will end up operating a health insurance that will just cover those people that can ordinarily have a means of coverage. But the poor are not encapsulated in the former document. But in this new National Health Insurance Act, National Health Insurance Authority Act, there is a provision in section 24 that talked about establishment of vulnerable group funds.
The new NHIA Act is seen as a move that will change the healthcare delivery system in Nigeria, and there is the optimism that it will bring about universal healthcare coverage in Nigeria. Professor Sambo speaks on its implementation process.
Number one, we intend to have a committee that will look at all the ramifications of how to operationalize that law. For example, if you are having a business in Nigeria, I'm giving an example without prejudice to what the committee will bring about. If you are undertaking any business in Nigeria, you have to show evidence that the enrollees, the workers that are working with you are covered by social health insurance. If you are coming as a foreigner, you have to show, you must have a registration with health insurance, just like it's happening in any other country. People will have to pay insurance maybe before they move to the other country. So this will be institutionalized. Then vulnerable group, people that have no capacity to pay by virtue of their socio-economic status. We are working on, another committee is working on various innovative financing mechanisms. So we are trying to harness what are the various innovations that we can use to ensure that this fund is made available for the vulnerables.
He added that the Basic Healthcare Provision Fund is a major intervention that will also help make implementation seamless.
Already, Basic Healthcare Provision Fund has given an opportunity for the vulnerable segment of the population to be enrolled. Even though the amount of money that is being populated through the Basic Healthcare Provision Fund is far cry to be able to meet that. So that's why we need an overarching vulnerable group funds that will drive health insurance from multiple sources. And if we do that, we have a compulsory enrollment, we have the vulnerable group funds, and NHIA is now a promoter, a regulator, and enforcer, so we can enforce and ensure that things are happening.
The new NHIA Act has given health insurance a well-articulated structure that will make its implementation smooth in Nigeria.
If you look at the new National Health Insurance Act, it has clearly demarcated health insurance into two. The health insurance for attainment of universal health coverage and the health insurance that can be driven by the private sector. So for the health insurance for universal health coverage, NHIA and state health insurance will drive it without any interface by the HMOs. In other words, HMO are not to be as the intermediary between the primary care and the secondary care. So it will be the whole responsibility of the National Health Insurance Authority at the top and the sub-national health insurance agencies at the state level. But HMO's role have now been redefined. They can do private social health insurance. If you go to any country, you see the public health insurance, which is a social health insurance, coexisting with private health insurance. But the bottom line is whoever is going to go for private health insurance must subscribe to private health insurance because it is a mandate, it is mandatory, and because it is a solidarity system.
Though social health insurance is the surest path to universal health coverage, some organizations have been reluctant about being part of the NHIA for obvious reasons. Professor Sambo explains more on the way out.
They were reluctant because there was no law. And now that there is law, they don't have any alternative than to come. But the good thing about this new law If they feel that they are benefiting from services far beyond what NHIA can cover, they can have a provision of what is called surplus health insurance or plus health insurance or supplementary health insurance, so that they join the health insurance for general people under the basic arrangement. Then anything beyond the basic, they can liaise with health maintenance organization to provide services for them, including travel abroad for healthcare. But we don't want to. We want to ensure that we have our own health system that can take care of everybody in the country, and NHIA will substantially address that, because by the time you are providing services for all the people in the country, so much money will go into the healthcare facilities, and so many improvements in terms of human resource, in terms of infrastructure, in terms of even physical structures can be seen, and more services can be delivered.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. Today on our stakeholders segment, we'll bring you an exclusive interview with Professor Hadiza Shehu Galadanchi, a renowned gynecologist who is passionate about maternal care. She is the proprietress of Standard Hospital Limited, Kano. She gives a brief on how and why she ventured into private care.
When I came back to Kano as a gynecologist and obstetrician and working in the teaching hospital, I realized the need for private health care. I had quite a number of patients that will come to the teaching hospital, but would tell me, please, doctor, can I see you somewhere else? I wasn't really ready to go into private practice, but the gap was quite obvious. And I realized that the only way I can function well as an obstetrician and gynecologist was also to give people an opportunity that they can see me privately.
Professor Galadanchi is also an advocate of health insurance, and she expresses her views on the National Health Insurance Authority.
NHIA scheme is an excellent scheme to support Nigerians to be able to get quality care. And I think, when Nigeria decided to have NHIS, I think it was a great, decision. And I know we had a lot of teething problems. As usual, you have a lot of teething problems before you can actually get it right. But we are on the way of getting it right.
She speaks further on coverage.
NHIS does not cover the whole of Nigeria. The percentage is still minimum. I probably don't want to say a percentage because I'm not really sure of the percentage, but I know it's minimal. Now, what we need is that the states, as I can see, some states are also providing health insurance scheme. So the states should also get into the they should provide insurance for their population. Then community insurance, because right now I think NHIS is just taking the tip of the iceberg. You have the state and then you have the community. The community is the largest as far as I'm concerned. That is where, for example, all the complications we have in obstetrics and gynecology is in the rural areas. And the rural areas cannot access NHIS. So we've got to ensure that there is community insurance, which I think NHIS is it's on the way of getting that. Yes, through the basic healthcare scheme, we should have insurance for everybody.
Professor Galadanti also applauded NHIA for its no-debtedness policy, as it has helped in reducing late or no payment by health maintenance organizations.
I think NHIS has done us good by introducing that indebtedness. Indebtedness is a letter of non-indebtedness, because that's the only way NHIS will give them their money. So you have to sign that they are not owing you, all right, before NHIS pays their fees, and that has made HMOs to be, paying back the facilities. But I think we still have some HMOs that are still giving us problems. At times you go to hospitals and you see that we're not taking any more patients from this particular, HMO, because you have almost 6 months, almost a year at times. Your fees are with them and they have not verified, neither have they paid you. Even as I said, I think it's getting better, much, much better.
She speaks further on some challenges bedeviling health insurance and the health sector at large.
I feel that we need to improve the capitation. We need to review even though we have reviewed some of our services, I think there's still some that need to be reviewed. Then there are certain services that are not covered by NHIS. For example, I'll give you an example. I'll also go back to gynecology, infertility. Infertility, the investigations in infertility are covered, but I think the treatment is not covered. Such an amazing thing. How can you cover an investigation and don't cover management? Investigation is part of management. So I think the drugs are not covered. Fertility drugs are not covered. So I think that needs to be looked into. There's certain services that I feel NHIS should review and probably include.
That was Professor Hadiza Shehu Galadanti, passionate obstetrician and gynecologist, an ardent advocate of health insurance in Nigeria, sharing her thoughts. We'll now take your questions in our last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: what are the contribution sets for the informal and formal sectors?
The contribution sets for the informal sector, the main contribution set is what we call the Basic Healthcare Provision Fund, which is an intervention program by the federal government. 1% of the consolidated revenue fund that has been given to states to cover their vulnerables, and the states will obviously give counterpart funding so that the program is actually sustainable. So the government pays its own part, and the states that are part of this will give their counterpart funding so that they can actually cover their vulnerables. For the formal sector, formal sector is largely contributory. In the federal government formal sector, which is our major formal sector program, we have about 3 categories. So we have those that are paid on behalf of federal government because they are treasury funded. So the federal government deducts the health insurance component from their salaries at source and then disperses those funds to the scheme, and we then cover those people once they're registered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
With this, we've come to the end of today's episode of Easy Access to Healthcare for All. Please join us next week, same time and same station, for another interesting package. Wishing you a prosperous new year.